Hello, welcome to the Zermed Show. I'm your host, Dr. Braha. On the show, we will feature local physicians and healthcare leaders who are experts in their respective fields and who will share their experiences and wisdom with us. We cover a broad range of health topics on the show, and today we have Johnny Hop, Director of the Pharmacy at One Brooklyn Health. Welcome to the show. It's really nice to have someone from pharmacy. I'm not sure that we've ever had a pharmacist on the show, but it's really an honor to have you. And to be the director of such a large institution here in Brooklyn, I think it'll be great for our viewers to learn about how a hospital pharmacy works, how outpatient pharmacies work, and what your role as a pharmacist in the team of providers who take care of patients, what your role is and how important that role is, because after all, if our patients don't get their medicines and they don't know how to take them right, we're not going to get anywhere. And so welcome, Johnny, to the show. Tell us a bit about you. Let's learn about your history, your past, how you got here.
Sure, thank you, Dr. Broad. Thank you for having me. So I was actually raised in Brooklyn. I actually live very close by. I went to high school at Brooklyn Tech, I'm a Brooklyn person. I went to Long Island University in Brooklyn for pharmacy school. And after pharmacy school, I was happy to land a job here as a resident here at Brookdale Hospital. And after my residency, again, I was fortunate enough that I was promoted to pharmacy coordinator. And after that, I obviously became the director here at the One Brooklyn Health System. So I was sort of born and bred at this institution. I've grown up here with a lot of my colleagues here, so it's been great working here. We get a lot of support from our medical staff and our administrators, and we're able to expand our pharmacy program. Pharmacists, usually when people think of pharmacists, they think we're behind the counter, we're counting medications, and that's what we do. But for pharmacists, we do a lot more at the hospital. For example, here at Brookdale and our sister sites, Kingsburg Interfaith, our pharmacists do make IVs, we do chemotherapy, we make TPN. We are very automated. We have our electronic medical record, the Epic system, which pharmacy is very involved in. We also have automated dispensing cabinets that we have medications dispensed from there. So if you can imagine, at Brookdale, every month we dispense about 100,000 pills per month at this site, and imagine the other two sites combined. So we do quite a lot of dispensing. Pharmacists are integrated with the medical teams. We go on rounds with the doctors and the nurses. We are part of the team, and we really assist the doctors and nurses to make sure that patients get medications and they get the right dose at the right time. In addition to that, we also run a pharmacy concierge program that enable us to help our patients that are not so compliant. So what we do is, as patients get discharged, we have the prescriptions ready for them. So when they're discharged, the pharmacy technician or pharmacist will go and do some counseling with the patient, make sure the medications are administered to them. They will go home with them. We will actually do a follow-up phone call to make sure that they're taking their medication. So that usually reduces a lot of the readmissions to the hospital.
Yeah, it's a nice overview of what you do. And you know, for people watching, when you see us walking around the hospital and you see the doctor and you see your nurse and all these other people around, one of those members of the team is a pharmacist who helps everyone coordinate. And I can't tell you how many times in my own practice where the pharmacist plays such a crucial role when we're seeing patients in the hospital, looking at what the patient was on at home, looking at what they're getting in the hospital, making sure there's no interactions. And I like how you said we're not just behind the counter counting pills, really a huge part of the care team. Tell me, you know, getting back to your history, Brooklyn born, Brooklyn educated,
yes.
Working, you've never left Brooklyn, ever.
I never left Brooklyn.
Never left Brooklyn. Tell our viewers, what motivated you? Why were you drawn into becoming a pharmacist? What motivated you to become, a pharmacist here at One Brooklyn Health?
Well, yes. So, I had my mom was very sick one time. I remember when I was a kid, and we had, we were young, and obviously we didn't have a lot of money, so we had to go to the pharmacy to get medications and antibiotics for her. And I remember when I walked to the pharmacy, I was a kid, and I didn't know what to do, and the person behind the counter was very helpful to me, and he explained everything, and he said, and how can I help you? What do you need? And he was just so nice, and for a kid that was sort of new in the country still, and he was very nice to me, and I always remember that person. That was very good to me, and I said, one day when I get older and I can help somebody, I want to be like that. So
Yeah, there's someone that that had a good impression on you.
Yes,
That was
yes.
a pharmacist. That's really nice.
yes, and he was very kind to me. So
Yeah.
obviously, I got the antibiotic, and he gave me the counseling. I should, my mom finished the dose and everything like that. So it was, and I said, in the future, this is what I want to do. This is what I want to help somebody just like that. I want to make an impact. And fortunate enough, Brookdale had the residence program. The college pharmacy was here in Brooklyn, so everything sort of worked out for me.
You didn't have to go, you didn't have to go too far.
I didn't have to travel too far. I didn't have to, waste too much tuition money. So, I stayed here, and again, I've been blessed. The medical staff, the administrators, everybody's been very supportive of the pharmacy department. So that's why we're able to grow and sort of grow our profession. And hopefully, we can set an example and have every pharmacy department run like we do.
So we have to thank that pharmacist back when you were a
We-
child
yes,
for
yeah,
bringing you
yeah.
here. So 100,000 pills a month, that's a lot,
Yes,
a lot
yes.
of pills. How does it go from the doctor writing the order in the computer to give, say, Mrs. Smith some pills for her infection, and they put the order into the computer? Give us a quick step-by-step of how the process works in those 100,000 pills a month to make sure everyone gets the right medicine.
Oh, yes, sure, yes. It's a lot of work goes into the back end with Epic, with our electronic medical record. So pharmacy working with the physicians. We have to build the order sets for the doctors. So what happens when the doctor writes, let's say for Tylenol for Johnny, he puts in the order, but in the back end, all of the pharmacy IT staff members have already built the database for the physician. So they can select, the patient's name, the dose, the drug, and then where the patient is to be sent. So once the order is sent, it goes down into a queue in the pharmacy where we say, okay, this dose is okay for Johnny, we can release the dose.
You check if it's the
Correct.
right pill, the right dose for the patient.
Yes, so we go through all the checks, right dose, right pill, right patient, of course, and even right indication for the patient. And once pharmacy approves that order, it releases through the Omnicell system, which is upstairs throughout the whole house. And the nurse is able to dial into the Omnicell, dial up Johnny on the screen, and then be able to pull out the Tylenol.
Almost like a fancy candy machine.
Correct, yes.
You want Doritos, you press C4 and that drops down.
A very expensive.
Very expensive dispenser, but it helps ensure that the right patient gets the right drug, and it's the right drug and the right dose for that patient.
Correct.
So it's really so important, the pharmacy department in a hospital. So the patient gets the medicines every day, and now it's time to go home. Give us some details about how you start to get involved, or your staff get involved, in making sure that a patient ready to go home from the hospital now transitions to their home meds, their home medications properly.
Right, so we have, like you mentioned earlier, we have pharmacists integrated in the medical teams. So they know when the patients are going to get ready for discharge. So them working with the social workers, the nurses, and the physicians, they give us a heads up that a patient's going to get discharged. So we will actually collect the discharge summary. We'll collect all the discharge medications that are ready to be dispensed. We will actually send it to our retail pharmacy, which is on site. We will dispense it. We will send it back upstairs with the intern, and the intern will actually do a counseling session with the patient to ensure that the patient understands how to take the medication, ensure that the patient's compliant, and any follow-up that's needed. And at the end, we also come with another phone call, maybe a day or two later, to make sure that the patient is compliant.
When we do counseling, as physicians, we tell the patients this is why we're using it, and some of the risks, some of the benefits, and then they go to the pharmacy and then they're given a whole long list,
Right.
this printout, which can be very confusing. So when your intern goes up there, they're really going over each and every aspect of the medicine and counseling them even deeper than the physicians have done, probably.
Yes, correct. So what we do is we try to tailor the session to the person, because obviously here in Brooklyn we have a lot of different cultures here. We have people that don't speak Spanish, people that speak English, people that speak all different languages. So we try to tailor the session to them, and we try to be very sensitive to the culture, and we counsel them on certain things that we feel like they want to hear. For example, we have a high salt diet for patients. We try not to. We explain to them you need to lower the salt intake, but we do understand that their diet is mostly salt based. So we're very sensitive to that. We go through in depth with the other drugs that they take at home. We go through also some of the OTC items like vitamins and things like that. So we try to give them the whole, the package of counseling so that they can make the best.
I'm sure that the patients must really appreciate this. How's the feedback from this?
Yeah, they love it. They love to hear from us. You know, we go into very deep detail, sometimes too much details, but I know they do appreciate it, and we get very good feedback.
Do you think it makes a difference? People are taking their medicines more reliably. They're getting their prescriptions better with this program.
Yeah, so we track some data. We have remissions data, and we track that, and it seems like the patients that we do counsel, they come back less. So we are very successful.
That's a huge impact to see that the patients you're getting involved with come back less to the hospital. That's a good sign. You know, I know from when I was a resident working in the hospital, we'd hand off a stack of prescriptions, and sometimes they'd come back and say, well, I couldn't find parking at the pharmacy, so I never got the medicines, or the pharmacy was closed. So your concierge service here really eliminates those speed bumps or those blockages that patients have had to getting their medicines. So this is truly a concierge service. You bring them their drugs, you teach them about their drugs, and you follow up with them with some calls.
Correct. Yes.
So that's a nice transition from inpatients to patients getting home. Let's talk about when they come back to the doctor's offices, what we call ambulatory care, when you see a doctor in the office. And here at One Brooklyn Health, with your pharmacy program, you're also involved with patients who are not in the hospital, but visiting ambulatory services.
Correct.
So tell us about that program.
Yeah, so we, the pharmacists are integrated into the ambulatory care program here. We actually have a program called medication management, where we actually deal with patients that have diabetes, have a high blood pressure, heart failure, and we actually get recommendations from the inpatient side. So as patients get discharged, we work with the discharge team for patients that need follow-up. And those patients get sent to the ambulatory care center for primary care follow-up. And we actually have our service, medication management. We follow those patients. We go through the same counseling. We work with the physicians to make sure that their dose is correct, that they get the right medication for the right indication, and that they get follow-up for all the treatments. We also give glucometers, free blood pressure machines for for patients that need it, and that's really helpful. I mean, it's a little investment in their health, and I think it pays back in the long run.
Right, I agree with you. You know, when patients leave the hospital, it's a very significant transition back to home, and having this follow-up to ensure that they're doing the right thing and to monitor for side effects is important. You know, just as much as they're going to see their doctor, they can make an appointment with one of your pharmacists and have counseling as well.
Yes, correct. Yes.
Tell us what else is offered. You know, I know that pharmacists are trained in giving medications, but you're still part of the healthcare team. What else goes on during these visits? Healthcare screenings that might be suggested to patients?
Yes, I'm glad you brought that up. So we also assist the physicians in screening for colon cancer, for actually diabetes, the initial screening, for heart disease, for a lot of the things that sort of we can intervene as a pharmacist, that we have the knowledge on, again with the doctor's assistance. So it's been great. The patients really love it. They actually sometimes get through the appointment faster, right? Because we're right there doing it. So I think as us being part of the medical team, it really works and helps them feel good about getting healthy.
Yeah. So what I want our viewers to understand today is how comprehensive this program is. This is not just a pharmacist behind the counter just making sure that the pills are going in the bottle and it's the right drug and there's no allergies. Real comprehensive type care here at One Brooklyn Health and with your pharmacy department. In working with the physicians, say for complex patients, cancer as an outpatient, biologic drugs like for rheumatoid arthritis or for Crohn's disease and colitis, how does that process work where patients may have to learn to inject themselves, such as insulin pens or some of these medications? Are you guys involved in that as well?
Yes, so during the medication management clinic, when patients do present with those medications, we actually show them. We have demonstrators, we have insulin demonstrators, we have the Umari demonstrator pens. We teach the patients how to self-inject, how to do it properly. We also teach them the side effects afterwards. So it's been great, and we try to intervene at that point. Sometimes the physicians are very busy, so they're not able to do some of the counseling part. So we jump in and we help those patients do all that.
And with patients who come into you and see you, one of the things that I see in practice, and you probably see it as well, is they're taking a lot of over-the-counter pills, whether it's an Advil or a Motrin, but they're also taking supplements quite a bit. We see in our population, especially here in Brooklyn. How does that factor in? You know, for our viewers today who are going to the health food store and they think they're buying a natural product, which means safe, which that doesn't, we know that natural does not equal safe. That's a big problem I see in my practice where we don't always know what they're taking outside of the pharmacy. How does that practice of taking over-the-counter medicines and supplements, how does that work with you guys?
So we do sort of we ask an open-ended question to the patients because we know that nobody remembers everything they're taking. So we would say, we would ask a question like, do you take something else besides what the doctor gives you? And they would start, thinking about it. Do you take something, some of the vitamins that you see, over the counter? So then they would start engaging in a conversation where they would respond, oh yeah, I take this red one, from, this orange bottle, and then we try to guess because, we know most of the meds. So, there's a brand name, brand name vitamin that they take, or, maybe like ginkgo for memory, something like that. We would engage them in a conversation where they say, oh yeah, my friend told me that ginkgo is good for my memory. I take that, and then then we could start talking about the drug interaction. So I think that's really the way to engage the patient, to ask these open-ended questions, so they start thinking about what they're taking, that what's in their closet, aside from the ones that the doctor prescribed.
Yeah, I've had issues where I know that the supplement they're taking either has been shown not to really help with them at all, and I try to counsel them sometimes and say, hey, listen, maybe you shouldn't take this, but also the interactions, and that's a toughie because there's a lot of supplements that could interact with drugs, and there are vitamins which we can also overdose on. Let's talk about that for a minute of how we can best give advice to our viewers and to caution them about some of this.
Yeah, so we would say, every lines that they hear on TV, do not take anything unless approved by your physician or pharmacist.
It's a big line.
It's
a very important line.
Yeah, it's a very important line, and we should reinforce that they should not take things off the shelf while speaking to a pharmacist or physician, because even with Google, it doesn't catch everything, right? You need to speak to a healthcare professional to make sure that you're not doubling up on something that you shouldn't be doing.
Yeah, you never know that something that might be in a supplement could also be what's also in your medicine, and you could be overdosing. So that's a good point for our viewers, and that's why how important it is that you have this service where people can come forward and in a nice environment, bring all their different supplements, medicines, and you guys really help coordinate and protect the patients from some of these side effects. For viewers today who go to the ambulatory center here, they're given medications, they feel they're having some side effects. Obviously, if it's a very bad side effect where they think they're having an allergy or they're having trouble breathing, go right to the emergency room. But in terms of side effects and drug interactions, how easy is it for them to get back in here to see you or their doctor? How should someone who feels they're having side effects that maybe be a bit more mild, not emergency, how should they go about that?
Sure, so if it's something very mild, obviously, it's not urgent, we have the retail pharmacy that's open till 8 p.m. They're welcome to call them. We're also, the inpatient pharmacy is open 24 hours a day. They're welcome to call us too. We're very happy to help callers, anybody that calls that needs information. This is our community, right? This is our neighbors and our family, so we're willing to help any way we can. So they're very welcome to help call us.
That's good to know, that there's always someone around to give some advice, not to ignore a side effect of a medicine. Moving forward into the future, what do you see as big changes coming for maybe the inpatient and or the outpatient pharmacy of the future?
So we're working on a lot of different things. Again, we try to move our profession. We're going to keep on going up and really integrate us into the medical teams permanently. Really get involved with maybe the HEMOC field, which is going to be big. We're really expanding our ambulatory care services to all the sites across OBH. We're trying to integrate pharmacists in every one of those clinics and sort of aim for the specialty clinics. So diabetes clinic, we will have a pharmacist there. We will have a pharmacist at the HEMOC clinic. We will have a pharmacist at the heart failure clinic. And that will really help, especially this population where these diseases are prevalent.
We hear a lot about cost, especially now in the news, reducing the price of certain insulins to a low monthly cost. And I know our viewers today are thinking about their cost for medicines with their insurance. We know that almost every insurance plan has a different cost for a drug. And so you could have one insurance company and the drug's $100 a month. And then you switch and now it's $1,000 a month. Explain to us how maybe here at One Brooklyn Health you get involved, or social work, or how does the pharmacy play a role in the economics of drugs and helping patients really get the medicines they need but maybe can't afford sometimes?
So we have a coupon program that helps some of the patients with some of these medications. We also have a discount program at the retail sites where we really just give the patient that cost, what the medications are. And if it's really a urgent situation or the patient can't afford it, we do give free supply to those patients that qualify. And we really try to help the patients do that section where they're applying for assistance and things like that. So during that gap in insurance, we will help them to get whatever they need to make sure that they overcome that.
Very common problem,
Yes.
right? When patients come back and they say they couldn't get their medicine from the pharmacy because of a high copay. But here at One Brooklyn Health and in your pharmacy, you kind of have that 360 approach, I guess I'm hearing from you.
Yes.
That you're able to counsel them, you're able to get them the drug if they maybe can't afford it, or at least drop the price or find assistance. I find that a huge problem in practice where patients simply can't afford care, and their drugs is a big part of that. We talked about the inpatient, we talked about the outpatient care, we talked about your clinical role in the team. Patients come and see a pharmacist, not just seeing a doctor or a healthcare provider from the medical end, but from the pharmacy end. It's a great comprehensive program. When it comes to Brooklyn, we have a hugely diverse population. With language, if our viewers are watching today but have a relative who speaks a language that isn't English, or maybe a language that isn't so common, are they able to get help here? How do you accommodate them for our viewers who may speak a different language?
Yeah, so we have translation devices and translators. So we actually have a diverse group of staff members too, working here as pharmacists. So we're able to help them any way we can. But the translators that are built into the phones will be the major thing that they use. But
No blockages here, no
No.
roadblocks in terms of language. How about the literature that we provide to patients? Are we able to print that out in
Yes.
different languages?
yes, so we have it in the major languages that are spoken here. Yeah, yes, for the brochures and everything. Yes.
Amazing. In our last few minutes here, let's hit on some of the points that we talked about. The importance of checking the list of medicines when someone comes to the hospital or to the doctor, checking for interactions, checking for allergies, monitoring for side effects. After you have the patient, say, on cruise control and they're taking everything well, how often are they coming back to see you? How often should they be seeing the pharmacy coordinator or their primary doctor? What do you recommend?
So we do a monthly follow-up initially, just like the medical visits, just to make sure they're maintained and they're consistent and they're taking their supply medication. And then we do 6 months and then a year. So we like to see that first month, that when they come back, that we check their bottles, make sure that they're up to the part that they're supposed to be up to, make sure they're refilling properly, and that they don't have any questions for us. And as they get stable, then we'll move.
I have another question that has come up in my practice quite a bit with pharmacy. A lot of our patients travel. They may go from where they were born to visit family for a month or two. They may go away for the summer. And a lot of the pills or a lot of the medicines we prescribe, they get a month at a time. How do you deal with that, with somebody who may be out of town for a bit of a period?
Sure. So we do vacation supply. We just described, and actually a lot of insurances do cover vacation supply. And if not, we will advance those patients the vacation supply. So there's really no problem. They just let us know and we can take care of it.
So you can give them a advance supply
If
of
it's 3 months or
medicine.
2 months, yeah, if they're going away or they're going to visit their refill mark. then we can
How
do that.
about with refrigerated medications or things that can't be out of the freezer or the fridge for a long period of time? How do they work that out when they travel, or what do you recommend?
So I recommend they bring a co-pack. They can do that. They can bring a little ice pack that you can buy or at any retail pharmacy, and you just lock back the insulin and put in the
Hop
co-pack.
on the plane and
hop on the plane, you should be okay.
head out to the Caribbean
Yeah,
or
Caribbean,
wherever
yeah.
it might be. It's really nice. Your story's great. You were motivated by an experience with a pharmacist when you were a child taking care of mom, and you really made an incredible journey into your profession, and to be a leader of the pharmacy at such a major institution at One Brooklyn Health. Really impressive. I applaud you, and I hope for our viewers today who are watching, especially someone young as a child watching or a high school student, I encourage them to get into the field of pharmacy. We have about a minute left. What advice do you have for a young budding student or a chemist or a biology major who's thinking about pharmacy? What's your 30-second suggestions here?
I think you need to look and see, help as many people as possible. Don't worry about everything else. You worry about the person that you're trying to help, and it will come. Things will come along if you try to do the right thing.
That's a great message. Just do the right thing, and as long as you're helping people, you're on the right track.
Yes.
And you're certainly helping the patients here at One Brooklyn Health. Johnny Ha, the Director of Pharmacy at such a big institution here, serving a great population in Brooklyn, and thank you for joining our show. You educated me. I'm impressed with your program. It's just outrageous how much you're doing here for patients in the pharmacy, and thank you.
Thank you, Dr. Brown.
Thank you for watching our show. I'm your host, Dr. Braha. It is my pleasure to help educate you. Today we had Johnny Ha, the Director of Pharmacy at One Brooklyn Health. I invite you to become involved and educated. Visit our website, zirmed.com. Check out our tools, connect with us on social media. You can also call us at 718-510-2103. Stay well, be safe, have a great day.